Hi all, welcome along to our 9th webinar, and it's really good for you guys to join us online. Just a quick note about how these webinars work. My name's Nick. I think I know most of you because we've been online going for about 10 months now. If people aren't familiar with it, there's a little questions box that's come up in the control panel on the right-hand side of your screen. If you hear anything that you want to ask a question about, you can just type your question in there, and then once Kevin, Tara and Maria have finished talking, Ines and I will go through the questions and we can have a discussion then. So you could, or you can wait until after the presentations. If you've got a problem, if you just send a message in the little chat box at the bottom, then Ines or I will try and help if there's a problem with the sound quality. And we will share all the slides and a link to the recording, which will be on YouTube, probably on Monday morning, because it takes a few hours for it to get set up. So we'll send that out to everybody who's come along this week, and also everybody else on the list next week. So online this morning, we've got Kevin, Tara, Maria, Ines and myself, Nick.
Hi.
And we've got, this week it's called Co-Production It Can Work. So we're going to be hearing about some work around co-production that's had a big impact in the way that services have worked, both at a local level, because we'll be hearing from Kevin and Tara about work in London, and also from Maria about national work with the Slovak government about influencing the use of EU funds and how it's used for services for disabled people. So without further ado, I'm going to hand over to Kevin and Tara, and hopefully this will work. And you will see their screen coming up almost about now. There you go.
Okay, we're off. All right.
Over to you.
Hi everyone, I'm Tara. I'm from the Hammersmith and Fulham Coalition Against Cuts.
Hi everyone, my name's Kevin Caulfield, and I'm a policy officer working in the Public Services Reform Department of Hammersmith and Fulham Council. And the Public Services Reform Department is a cross-cutting council department, it's a corporate department. And I'm also have been actively involved as an activist in Hammersmith and Fulham, working with disabled residents as part of this whole process that we're going to talk to you about. So just to give you a little bit of background about Hammersmith and Fulham. So Hammersmith and Fulham is a London borough, a London neighbourhood, and is one of the 13 inner London boroughs situated in the central western part of London. How do I do that?
Just
Percent.
we're trying to move the slide on, sorry.
You can just press.
Isn't it just arrow?
Yeah.
Yeah, no, it doesn't work. Okay.
Which do you press? It's just it was not at the front, so it's at the front. So it's gonna...
Okay, cool. Okay,
sorry about that. So just to give you an idea, the population of the borough was 182,493 people in 2011. That was the last census, but the current estimates for 2018 show the population has risen to around 185,000. And in 2011, 12.6 of our residents reported through the census having a long-term health condition or impairment that limits their day-to-day activities. So that's around 22,000 people. But we know that that's likely to be underreporting, and national data has disabled people around 20% of the population. And I put a link on the bottom of the page, just if you're interested to find out more about Hammersmith and Fulham, you can go to the link.
Okay, the other thing to know about Hammersmith and Fulham is that it has a long history of disability rights activism run and controlled by disabled people. So we've had a borough-based, a local area disabled person-led organisation, I think for close to 40 years, a very long time. But more recently, I think because the disabled person-led organisation has become very focused on service provision, a group of disabled people, including Kevin and I, set up an independent campaigning focused group of, well, disability rights activists essentially. So that was the Hammersmith and Fulham Coalition Against Cuts that was set up in 2006, really in response to some really worrying policy decisions that were taken by the then local authority. HAFCAC is absolutely independent. We have no local authority funding, and in fact we've only very recently, kind of 12 years on, got some small funding from an independent funder to continue with our campaigning work and to focus on building the capacity of other local disabled people. But we're focused on the social model of disability, of course, and we I suppose it's important to know that a lot of what's happening now and what we're going to talk to you about in terms of co-production, we think came from that independent activism. This wasn't a local authority idea. It absolutely came from disabled people ourselves. The whole concept of co-production, as we know, is an idea from disabled people. So 3 years ago, on International Day of Disabled People, the local authority announced that it wanted to do something on disability, and they asked me to chair it. So we set up the Disabled People's Commission with funding from the local authority. That's important to know. But I agreed to chair it on the understanding that we would have complete autonomy in terms of what it is we wanted to talk about and what it is we wanted to recommend. So the idea is, sorry, I'm talking but not moving the slides on, apologies. So the aim was really to set a new way in place, a new way of doing things where disabled people, disabled residents, councillors and council officials and other organisations in the borough, of course, could work together, really focusing on what Nothing About Us Without Us looks like in terms of local decision making and local policy development. So we focused as a starting point, because the Commission was also focused on social model of disability, we wanted to focus on what was stopping disabled people from participating in local decision making and local policy setting. So really we did an exercise in identifying the barriers that prevent disabled people being involved in policy setting. And you'll see from the bottom of this slide a link to the report that we published in the summer of this year that has some really groundbreaking recommendations within it. Okay, Kevin.
So as Tara said, the link at the bottom of the page to the report, that's quite important in terms of what we're going to continue to talk about now, because most of the information that we're discussing with you is in that report. So it's really well worth looking at the report and using it where you can to support co-production in your neighbourhoods. Okay, so why co-production and what does it mean? Well, for us in the report and the work that the Commission did, the Commission highlighted the myriad of barriers facing disabled residents on a day-to-day basis still in 2017. And on page 6 of our report, we've produced, I think we had about 30 pages of the barriers that people were facing, and we've tried to represent it into a barriers map, which is on page 6 of the report. And that's quite striking in that lots of people who don't realise how much exclusion and discrimination still exists for disabled people can see very clearly from that map in one page just how difficult things are. So co-production, as we all know, sometimes can be perceived as a difficult concept, but for us it's about having a mechanism, something to hold on to for everybody. It's a way to bring people together to achieve change together. And so that's what's really important about co-production and the terminology, and it's to use it as a mechanism. The report, the Commission produced a working definition on co-production, which is co-production working together means that disabled residents and decision makers, and that's really important for us to influence the decision makers, are working together in an active way. So in a really active way, people are involved from the beginning, disabled people are involved from the beginning with ideas to plan, design and review policy and services that affect our lives to get rid of the barriers that we face. And that's just a broad definition, but what's really important is the work that we do and not just the definitions. As one resident said, one disabled resident said, co-production needs to be done across the board, and as scary as it sounds, it needs to be done in a big way. So the Commission, well, the next slide is how to make co-production happen. And the Commission, and you'll see that in the report, has come up with 8 recommendations for change on co-production. And if they're all implemented, that would significantly change decision-making and policy development in Hammersmith and Fulham. So I'll go really briefly through the recommendations. But as I say, they're all in the report on page 16. So the first one is about getting the council to operate in a human rights way of working in the way it plans policy and services, and that the council has agreed, these recommendations are already agreed by our council in December of last year. And that the council will be using the UN Convention on the Rights of Persons with Disabilities as the base for change. The second recommendation is developing a co-production policy strategy that works across all of the council. So traditionally, work with disabled people and local authorities is often based in social services, and we have all been saying for a very long time that that's not enough. So what's really important about our work is that recommendation 2 commits the council to implementing the co-production strategy across the whole council. Recommendation 3 is to develop an accessible communication strategy that will promote co-production in the whole borough. The fourth recommendation is that the council works with disabled residents to put together a co-production support strategy, so mechanisms so that we are able to practically implement the work on a day-to-day basis. Recommendation 5 is that the council co-produces a framework around planning services and commissioning, which will include the issues of quality assurance and monitoring and evaluation, and disabled people and disabled residents will be involved in designing that framework. Recommendation 6, really important, which is about resourcing co-production, because the resourcing is always a challenge, but often the resourcing is not thought out, and that's why co-production often struggles or fails. So that's going to be a really important element for us. Recommendation 7, which is, and we have said that the other 7 recommendations won't work unless you implement recommendation 7, which is to review support and funding of disabled people's organisations, because without disabled people's organisations and disabled residents, there's nobody to co-produce the way forward with. And the last recommendation is recommendation around commissioning independent monitoring and evaluation, because so many of us are used to either decision makers themselves or service providers doing their own monitoring and their own evaluation, and often everything can seem rather better than it is. So just where co-production has already started to have an early impact. So well, the general buzz and profile of disabled people and disabled residents in our borough has gone up. I can't really tell you how much it's gone up, but it's gone up really significantly since we started this work, and since we've started to be able to work on some initial pieces of work. So I'll just give you a few examples. Disabled people have been working on the development of a disabled people's housing strategy. Disabled residents have been involved in we're refurbishing our town hall and the surrounding land, building more housing, a new cinema complex. So 6 disabled residents have been involved in that, in the planning application. So normally you're lucky if it's 1, but we had 6. And we also had an external from outside of the borough disabled person as an architect and access consultant advising the council on the planning application. We earlier this year had a voter registration poster campaign targeted at disabled residents. So we had 3 posters around the borough of disabled residents voting. I think that's certainly the first time that Hammersmith and Fulham have done any targeted work on voting and disabled residents. And the council has agreed to move away, to creating an independent living strategy, moving away from what the UK uses as a term as personalisation. And so we're moving to a strategy which is designed and defined by disabled people and not by the Department of Health and government departments. We had recently a review of direct payment personal budget support in the borough. What was important about that, the review was carried out by an external disabled people's organisation from another borough, from the London Borough of Richmond. So again, the council knows that it needs disabled people to review the support and services that we commission. And just lastly, Monday, Tuesday and Wednesday, all of our elected officials, all of our local councillors are going to have disability equality training, and that's being provided by Inclusion London, which is a disabled people's organisation. And just at the bottom is a link to it's just for interest, it's just a review of the direct payment support borough report.
Okay, back to me. So I thought we just sort of round up a little bit by talking about what we've learned through the process of sort of forging ahead with co-production, and then also a bit about the next steps in terms of what's actually happening, because I think Kevin's talked to you a lot about the report, and I think just getting that report written and getting the recommendations that local authority have committed to implementing those recommendations, we're still quite a long way, I think, if we're being honest, from actually realising all the detail of those recommendations. But I think it's quite useful reflecting a bit on how we've got to where we've got to in the scheme of things, a relatively short time. And I think the key element from that, you can see from the slide, is the need for campaigning. And I know lots of you are doing that in your local areas, but I think the sense that disabled people coming together with allies where it's appropriate to really think about what we want to change, how to describe the change that we want to make, the vision for us anyway in Hammersmith and Fulham of what co-production really looks like, where disabled people are at the heart of decision making. Really, you know, what does nothing about us without us look like in the borough, and the importance of that campaigning to be independent. And I think, as I said right at the beginning, our local DPO has been around for a very long time, but they are effectively a service provider, which is fine, but it made it much more difficult for them to do some of the really frontline campaigning that Hammersmith and Fulham Coalition Against Cuts was able to do. I think the next thing is about being clear about what it is we want to achieve, and being really clear about what those messages are to ensure that people understand where we want to get to as disabled people. And I think describing the change, so it's, yes, absolutely knowing what needs to change, but then what the solutions are in terms of removing those barriers. The next one is obvious, but I think it's important to highlight, which is how important that campaigning is in terms of needing to be led by disabled people. And I think that's really crucial, but also building a collective of disabled people from right across all impairment groups, but also experiences, kind of like gender and ethnicity, etc. The next one is about, however difficult this might be at times, reaching out and building relationships with local politicians. I think a lot of the really important work that we did with HAFCAC was building relationships with politicians who at the time weren't in power. So we got what we describe as opposition politicians, people who were wanting to be in power, to agree to some of the demands that we had, so that when they were returned to power and they are now running the local authority, that they could then deliver on those demands. But that wouldn't have happened if we'd not stood right behind them, pushing them in the right direction. I think the thing to know is these are people who are the decision makers in terms of spending the money, but also resourcing services, etc., etc. And then lastly on this slide, I think it's really important that we remind politicians that yes, we're disabled people, but we're also local residents and we are also local voters. So we are their constituents. And the truth of it is that they need to listen to us and they need to work with us if they're going to secure our votes in the future. Next slide. Is also me. So then what next for co-production? Well, I think we're really heading towards exciting times. What's going on at the moment is a recruitment process to create a Hammersmith and Fulham co-production implementation group. That's the working title, by the way. And that's going to provide leadership in terms of driving forward the 8 recommendations that Kevin's already talked about. So for us, that will be a mixture of disabled residents, councillors and council staff in senior positions, really so that we model the co-production that we've talked about in the report. So disabled people and council people working together to deliver those 8 recommendations. Also, really exciting, we've managed to persuade the council to recruit a senior manager to lead on co-production within the council. And we said that we think that's really important, that that's a disabled person, and the council agrees. I mean, this is groundbreaking stuff in the country, I think, and I think that was led by disabled people, but none of this can all be achieved wherever we are in the world, I think. And then the next thing, which is what Kevin mentioned right at the beginning, there was quite a lot of discussion when we were talking about the recommendations with the council and implementation. They were wanting to put a co-production person in adult social care, and we were really clear that actually disabled residents are interested in much more than adult social care. That's really important, but we're also interested in planning. We're interested in housing. We're also interested in rubbish collection. So it was really important to have this role based in the Public Services Reform Department so that it could be truly cross-cutting. But as I said, I think the challenge really is ahead of us. So we've got a report, it's fantastic. The recommendations are groundbreaking. They're also strategic. I think the real task now ahead of us and for the implementation group is to actually turn those recommendations into reality and to operationalize them, i.e. make them real for every member of staff at the council. Because I think unless we do that, this will just kind of like become diluted. And I think the implementation group alongside the co-production senior manager, but also voluntary sector organisations, disabled people led organisations, I think together are going to make this happen. So I think it's a really exciting time for us. Okay.
We've read it. That's all from us.
That's all from us. This is how you can get hold of us. Happy to talk more after the webinar about in any more detail. We're just conscious of time.
Thank you very much. That's great. It's really good to see one part of England doing something interesting. I know there's lots of other bits of work, but without hanging on and wittering on anymore, I'm going to hand over now to Maria, and you will get a message, Maria, to invite you to share your screen, and hopefully it should work. Over to you.
Is it
working?
working?
Yeah, it's all working.
Okay. Okay, so thank you very much for this opportunity to speak a little bit about Slovakia and about what my organization I am working for is doing, or it's trying to do in field of co-production. So I will speak a little bit more about the situation in Slovakia, especially how we are trying to influence legislation or providing of services, and also how the structural funds are used and if they really are spent in line with the CRPD or horizontal priorities of the structural funds. So I work for organization Socia Foundation, Social Reform Foundation, and basically from the beginning, from 2002, we are trying to, with all our activities or financial support, to influence changes of the social system. Maybe just say our background is from the Dutch private foundations that came to the Western Europe after the fall of the communism, and they spent quite a lot of money on supporting alternative community-based services, mainly for people with disabilities or elderly. And the founders of our foundation were in very close cooperation with them. Our first director and administrator of the foundation was former Minister of Social Affairs just after the split of the Republic, Czechoslovakia, and but after finishing her ministerial state office, she directly went to the third sector, and from that time, from the early 90s, she was very strongly a strong person in this field. I will now focus more on our work with on a program of disability right program. And following our mission, we are trying to promote community service system that will support people in social inclusion through the life cycle. So our activities are focused on children and early intervention. Then during the adolescent or studying, the transit from the school to the work system, and also when people are adults. So for us, very strong emphasis is on deinstitutionalization and founding new type of services, and then till the elderly age, where we are trying to run a campaign and public fund to promote services for elderly in-house. To talk about Slovakia, I just very quickly would like to introduce our country's system or mechanism. Slovakia is divided in 8 regions, but it has nearly 3,000 municipalities. And all these municipalities do have all competencies, even if they are small villages with 10, 12 people, up to Bratislava, capital city, where over 500,000 people is living. So competencies are divided in Slovakia between all 3 stakeholders: regions, municipalities, and state or ministry. And concerning people with disabilities and services, social services for them, you can see that mainly the regions are responsible, but if you are old, then municipality should care for you and pay it. And the state and ministry is the one who is giving the legislative framework. They also take care on compensation and allowance systems, child protection, and employment services. And also, for us, very important inclusion in education. Even the school system is divided between these 3 main partners in Slovakia. So that's something what basically on one side you have to think how to cooperate with everyone, and somehow they should cooperate together. But if you are willing to change something in the system, you always face all these 3 entities. Regions, municipalities, and state are all self-governing. They are elected in different type of elections, so it's basically quite a complex system. I would talk more about 2 case studies or 2 other examples of work. One is more connected with the structural funds, and one about starting a new service in Slovakia for children with disabilities. So DI, I will shorten this. started in Slovakia, and this is really good example of how the third sector or NGO sector was the starter of the process. And as you can see, Slovakia wasn't very willing officially to start something, some transformation of the social system, but the structural funds were really a strong input for the ministry activities in 2010. Before, to be fair to the ministry was trying or starting the DI process in childcare protection system, also because some big scandals in the late 90s, but the child protection system was much more open for some changes, systematic changes. From the 2010, there were 2 years of very open government and minister who was trying to change and prepare this DI strategy, and this was quite successful. The DI strategy was written by the ministry, but in a communication and in work with other experts from not only from the field of NGO sector, but also from the side of the organization of people with disabilities. Unfortunately, from that time, from 2012, this government was not re-elected, and the whole process of DI was slowed down, and this was kind of our place where we really found our position in the structural funds very important. So NGOs in the 2012, in cooperation with the government, established a governmental council for NGOs. Basically, it is a organization that associates umbrella organizations of NGOs from the 31 members of representative of NGOs. There are 3 of them represents directly people with disabilities, and these 3 organizations through their members represents quite a large group of people. Maybe this would sound very officially, but if you are trying to change something in the system with the legislation on a national level, you always have to have kind of legal empowerment for doing something, and this governmental council as a part of the governmental advisory board has a quite strong voice, or they should be represented in each working group or something like that. Especially in the terms of structural funds, members of the council can send their representatives to the all working groups that were working on partnership agreements, on operational programs, or they are members of monitoring committees. we are still discussing the problem that these people are not directly involved in preparation of calls or big national projects, and on a regional level, because some of the regions also do have quite strong competencies in structural funds, and the partnership principle on their level is it's not really implemented. We are trying to cooperate in between these members in a governmental council. This group is quite active, and basically I have to say that we as members of the monitoring committees have the opportunity to speak with other people and ask for their opinions, and this is something what we are trying to do. And through all these official tools we do have, we can say that the structural funds in Slovakia in this programming period has directly two specific priorities that are oriented on transition from structural funds to community-based care, and there is a quite large amount of money directly allocated on these specific goals in two programs. This is something what we were really strongly fighting for, because Slovakia has most of the residential care in institutional form, and basically from 50,000 people living in social services, 42 of them are in residential institutional care. This is something what was Slovakia also asked by the CRPD committee to change. This was also the condition of the European Commission during the programming of this programming period, and we have to say that all the partners in the process were quite focusing on this, and we are now glad that this is already written in paper. The problem is, of course, implementation, and our concerns about the delays and not really fulfilling the horizontal priorities of non-discrimination and accessibility in all programs, not only the ones that are directly oriented on people with disabilities. So these are our concerns that we face till these days. But just to somehow summarize this first case study, we were in contact not only with NGO sector, but also with some social workers in institutions that were in the process of transformation before. We were strongly supporting self-advocates in these institutions, because this is something what we always see, that people who somehow live their whole life in institutions, they are not really prepared to speak from themselves. So we were in a contact with one institution that was willing to transform itself, and part of our work was also empowering these self-advocates to be able to speak for themselves on different type of events like conferences, roundtables, and even in the press or in the TV media. Then another important group we were we were networking was providers of the community-based services, because most of the institutional care is provided by the regional or public providers, and the small community-based services are mainly provided by the NGO sector. So these were also our very important partners. I already mentioned the organization of people with disabilities, the umbrella ones, but also small parents organization located in a special or specific regions or towns that were able to give us some relevant information or needs assessment of their children and their situation in the region. Of course, very important were some ministry officials, as it was mentioned in the previous presentation, building relationships with them on every level, not only the ministries or the official ones, but even on the desk officers on the ministry. They were really important for us sometimes. And on the European level, we really find it important to have contacts with the organization like ENILIS, or the organizations associated in a EEG group. And especially, and thanks to them, we also built some relationships with our European Commission desk officers. And all these channels and network were for us very important to move something with the DI in Slovakia. The next example is about early childhood intervention. This new for Slovakia new type of service was introduced to our legislation in 2014 only, and still we face the problem of very sectorial approach. As I said, this is introduced to the social service legislation. So we do have something in a health sector or in in educational, but they don't cooperate together, and this was lacking, and it still lacks somehow in Slovakia. For us in Socia Foundation, the early intervention is very important from the point of view of the prevention of institutionalization of the people. Yeah. So what were the steps we went through? At the beginning, there was only one NGO project that was applying in our foundation for the support in one call. But unfortunately, this project was not chosen, but it was so inspirational for us, and also in that we start a discussion with the other experts in Slovakia, brought some inspiration from abroad, and we started to look for partners, because we really had the view that this is something what could really change and cover a big hole in our system of social services for people with disabilities. Then thanks to the donor from Denmark, we got enough money to start a pilot project in three cities in Slovakia, and basically the outcomes from the beginning were so so attractive for other donors, then in two years we got enough money to start other three centers in other three towns in Slovakia. And this was not only a work of finding money, because the legislation already introduced the law, the service in the law, but they didn't say who is going to pay for this service. So therefore, we needed quite a lot of donors to run this service. But also we need to talk with the experts, with the NGO partners. Very important for us was a dialogue with the pedagogists and pediatricians, because and finding common or understanding of the work with the kids, and especially with their family, because the focus should be on the family and the kids, not only on the child. And this was the time when we also started very strong cooperation with the parents and parents organization, and basically this allowed us to push very effectively on the ministry and regions to scale up this service in Slovakia. After 3 years of the running of these services from this year, from 2018, thanks to the amendment of the law, we know who is going to pay for this service. The regions are now responsible for it. The ministry has also more specified the conditions of the quality and qualification of the service. And we also do have some first municipalities, mainly large cities, that are also trying to support this new service in their region or in their city. And this was, I think that this scale up was thanks to the cooperation or co-production between three partners. One is our foundation, then Association of the Providers and Supporters of the Early Childhood Intervention, and then very strong parent organization. I was trying to somehow sum up our roles in the partnership, but basically we are trying in Socia to make the advocacy and the legislative support, to open cross-sectorial and cross-disability dialogues, and still doing some fundraising. The Association of the Providers is basically focused on quality and standards of the services. Their vision is that this service would be available in whole Slovakia in the same quality with the same standards, and they are providing different type of trainings. And now, after we do have 29 providers of the early childhood intervention in Slovakia, and 24 of them are members of this association. So we can now cooperate and communicate with all of them. Some of them are NGO, and some of them are public ones. And parents are very important in formulating formulating their needs assessment, the feedbacks on the legislation, but also on the quality of the services. They also somehow give us a really contact with the reality, and they are very strong self-advocates. We are in this cooperation, we are trying to also find some funding for the parents organization to be strong enough and to be heard relevant for us. The last thing I just want to mention is very inspirational for us was the general comment on Article 19 published by the CRPD committee last year, and we have initiated a conference with the different organization of people with disabilities to start communication cross disability and to say, what does it mean for me to live independently? And from this conference, we have quite a lot of inputs, and we have decided together with the attendees that we will now this conference will be followed by roundtables that will focus on different type of problems, and our role would be more like intermediary between the voices of people with disabilities, different type of disabilities, and the official structures or the ministry or regions. Because we see also that not all the time the people or the organization with people with disability doesn't have enough capacities to be everywhere in all working groups. So but we still want to stay in touch and to represent or to somehow make a direct channel from them to these working groups. We can be part because we are members of the governmental NGO committee. And I just can mention another small or big victories that were done thanks to the cooperation with the organization with people with disabilities or parents organizations. And especially now we are in a process that Slovakia is trying to transform the special pedagogical counseling system. And this transformation will very strongly impact the families with children with disabilities or special needs. And we are now again making some discussions, roundtables, trying to come up with the problems that parents see and communicate them on a national level. So thank you for your attention, and these small cartoons are from the last conference we had in June, and basically, as you can see, these are principles of independent living, and these are areas we really want to somehow open on discussions with people and the officials. So we see it's ongoing work. It's work of empowering people with disabilities, creating place or environment where they can come and speak for themselves, and also preparing the ministry or regions to be prepared to and open for such a dialogue, because they are not always open for such events, and still I think that we have to our attitude to our work should be in very humility, because we still can be at the risk that we are the experts, but hopefully through the quite intense contact with the people who are we trying to support, that we will somehow overcome this risk in our work. So for other questions or more clarification, you can ask me or you can write after this. Thank you.
That's brilliant. Thank you very much, Maria. I'm going to be in touch with you about the early intervention stuff, but I'll do that offline because I'm sure that other people have got questions, and we will go to the slide now. So thank you very much. Ines, over to you around questions. I've got a couple.
Thank you, Nick, and thank you, everyone. Yeah, that was great. With slightly different, well, I'd say different obviously circumstances in London, in England, and in Slovakia, and obviously in England, I think the disability rights movement is much more ahead, and as people are. I mean, there is a much longer history of campaigning, and you can see where that has led to. I mean, with the work Kevin and Tara are doing in Hammersmith and Fulham, which is obviously really exciting. But also then from Maria's perspective, from trying to facilitate, and to facilitate the involvement of disabled people and input into the various processes nationally. So that is also really interesting. And Slovakia is still, I think, in this respect ahead of some neighboring countries as well. So thank you both. We don't have that many attendees online, so maybe as discussed with the presenters before, unlike in our previous webinars where we would ask you to type up a question, we can ask you to raise your hand, and you can ask, I will unmute you, and you can ask the question online. I think Camille already had a question. So Camille, if you don't mind, you can say your question, just say which country you are from. And given that we don't have that many participants, I would encourage you all to say something or to introduce yourself. So I will hand over to Camille. Do you want to ask your question, Camille? Let's just see if it works. I've unmuted you. We haven't done this before.
Yes, can you hear me?
Yes,
yeah.
Okay, it works.
Okay. So yeah, I'm Camille from Greece. I am also the development officer of ENIL. And yeah, and one of the founders of the Greek Independent Living Organization, iLiving. And yeah, my question is for the second speaker. And I am curious, when you said about the project you did and you with the donors from Denmark, and later you got more donors because they were successful. I wanted more information about this project. Are these personal assistance projects or something else? I don't know if it's clear.
Yeah.
Thanks.
Thank you. Just maybe to make it more clear, I was only mentioning support for one project that was oriented on early childhood intervention, support for the family for kids from 0 to 7, and it's basically outreach service. The multi team is coming and visiting family, trying to make them as much independent and as is possible, to learn them how to work with the child, and also how to communicate with their community, to build relationships there, and so on. So it wasn't really about this. All this support was only for this one project across 6 cities in in Slovakia. Sorry.
Okay, thank you, Maria. Patricia has raised her hand, so I will unmute you. If you can also introduce yourself and say where you're from.
Yes, hello, can you hear me?
Yes, yes.
Great. So my name is Patricia Scherer. I used to be one of the French members of EASPD and Eurochild, and I'm currently working for ICF, and we are implementing a project for the European Commission where we are organizing capacity building seminars in several member states on the transition from institutional to community-based care. So first of all, I'd like to thank you for this webinar, because it's really a topic that's very important also in regard of these seminars. We're working together with the European expert group, so I've been listening in, and this has been very, very helpful. I have more of a question of a long-term perspective, in the sense of, I know that co-production, what can you do that co-production or co-production methods become kind of an automatism for maybe municipalities or other administrative bodies that are responsible for creating community-based services, if you have some ideas for that.
Thank you, Patricia. I would leave that to Kevin and Tara, maybe. Your thoughts?
I think the question was about how we make co-production kind of the day-to-day way that
yes,
decision makers and public authorities and work. So I mean that's very strongly the premise of all of our work, in that you know, we could have, as a commission, looked at individual barriers. Say we could have taken housing or social services and independent living as separate strands of barriers, and come up with individual recommendations on how to change those particular services and support. And as the questioner said, what we need is a strategic response. So that's what we've done, and that's what's in the report, and that's why the report is really important for people to use. And part of it being the day-to-day business of public authorities can only be with the developing capacity building resources of disabled people, disabled residents, and disabled people's organisations, because you can't do real co-production without putting the foundations in place for those things to go ahead. And I think our strategy is that once the foundations are in place, then the co-production across, in our case, our borough, should significantly accelerate.
I think also we, in our report and in our meetings and discussions with the local authority and decision makers, we set out the very clear case for how co-producing services and policy making with disabled residents improved the way services were planned, designed, and delivered. And we don't make a big deal of it, but it's an important part of that case is how co-producing services with disabled people actually can save money for the local authority, because the local authority then is delivering services that disabled people want, rather than forcing a generic service on its residents. So I think that was important. I think it was really important to make the case for why co-production makes things better, improves the way a local authority not only delivers services, but the way a local authority engages with its residents.
Could I just add a quick, I guess, slightly different perspective from an ally, but I think there's a really simple message at the heart of it, is that if you don't co-produce, the change that you're trying to make happen will fail. And I think I've learned the hard way that the simpler the message about that, the better, really, because if people aren't involved, then the solutions that come through, and I think there's some really hard learned lessons in England about that. If it's not co-produced, then it just will not deliver what people need in their daily lives, because it's not just because it's a system imposed, but because it's not based on what works for people. So it's just a very simple message. Without co-production, the change will fail, and I don't think there's well, I've not encountered an argument that can counter that, really. And yeah, sorry, it's just the really simple one. It won't work if you don't listen to what work. Well, put people in the lead, really.
Okay. Are you going to make the presentations available?
Yes. Yeah.
Brilliant.
Maybe I can add something to your question. We realized in our case in Slovakia that we as a foundation, that our investing in empowering parents was brought us higher relevancy on every field. So I hope that if the official municipalities of ministry will somehow also come up to the idea that if they really want to change something, they have to have also relevant information and relevant people behind them. So that's one thing. And also now we are in a communication with economists and analytics. So there are already first two cost benefits analysis about early childhood intervention for kids with autism and kids without hearing impairment, that this is really something what can save money. So in the future. And also I think that what could work is showing good and bad examples. How Nick was mentioning, I don't know, just very simply example, if I will buy shoes for my daughter without she's trying them on, probably they won't fit her. And so in Slovakia we are now, the most of the money is from the structural funds is spent on infrastructure. And if we spend quite a lot of money on the infrastructure and these places are not available for people or elderly or parents with the strollers, so we will need more money to fix it. So basically these are the arguments we are trying to show them that.
Can I just, because I was thinking about, you know, I mean, I think what we're doing is significant as well, because what I said briefly, but that disabled residents and people are involved in the ideas stages about in relation to whatever piece of work that we're working on, because often co-production is badged as it's kind of co-produced once all of the ideas have been kind of more or less agreed and thrashed out between professionals and decision makers, and then the co-production often starts at the next stage, and that even if that were to be good, which we would argue it isn't, because it's not based on disabled people's solutions to the barriers that they face. But I think we need to be very wary of falling into the trap of accepting a lower degree of co-production, and we, we come up against that a lot every day, and we have to resist that, and we have to remain, as Tara said earlier, we have to stick to the messages, we have to stick to the plan, and because otherwise co-production just becomes a reframing of service user engagement, consultation, all of the things that we've experienced as disabled people, that just hasn't worked for us.
Okay, thanks so much. That's very insightful.
Hi, Ines, are you there? No? Okay. I don't think we've got any more questions, so we'll round up there. Thank you for people coming along and joining in. Everybody's email you can see is there. There were emails shared on the presentations as well. We'll try and circulate, we'll circulate the presentations, the YouTube link, and any useful reports that are linked to the presentations. I'll catch up with you, Maria, because it might be this a small paper or a summary of some of the work around the early intervention. I know that it would be really good to share. And I know that Tara and I were talking last week about this in England, so I think we'd be really interested in finding out more about that. So please do drop us a line, get in touch. Really happy to answer any questions. Or there's about 120 people now linked up to this network, so there's a chance to put questions out right across Europe, and even Australia and America. I think they still get newsletters from us. The next webinar we've got is more about thinking about communities. You mentioned, Maria, about linking children and young people into communities. We're really keen to be thinking about that. We've talked about it in previous webinars, but we're going to talk about it more in on the 30th of November. We'll be hearing from Sian Lockwood, who runs Community Catalysts in UK, which is all about very small scale providers and communities setting themselves up to support people rather than big organizations. And we know that this is something that lots of people have talked about from different countries, how difficult it is to find the right support. And Sian and Community Catalysts have done a lot of work on thinking differently about that and looking to set up very small scale operations in local communities. And we'll also be hearing from the guys in the Centre for Inclusive Work activities in Croatia. So we'll send out a link for that on Monday. Just a quick one, I've just mentioned, we've got about 20 countries represented now. This coalition is completely voluntarily run. So people give their time for presentations and organising and hosting and writing newsletters, all free. And we really appreciate your support. So when you get the newsletters and the links, please do share them with as many people as possible and encourage them to register and join in and listen to what people are saying. You can find links to all our previous presentations and YouTube videos on the website at it's community-living.info. There's a link at the end here. So there's a wealth of material now covering all sorts of challenges and learning from closing institutions right across Europe. And it's all just left to say a really big thank you for coming along. Thank you to Kevin and Tara and Maria for your time. It's been really interesting hearing about your work. And the one thing about this is when I press close, it's all very sudden. It goes quiet very quickly. So thank you for your time, and we look forward to being in touch with you soon. Any last words from Kevin, Tara, Maria, Ines?
Just thank you.
Have a good weekend. Can I just say, Nick?
Yeah.
You know those photos. What's really interesting, and it'll make people smile, I think, is the picture of I. We're both wearing T-shirts that HAFCAC created. That, and you can't really see them, but I can explain what it says. It's a picture of our local authority leader, Steve Cowan, in the guise of Che Guevara. And it's the strap line to the T-shirt is Hammersmith and Fulham, the Disabled People's Republic of Hammersmith and Fulham.
Cool.
And we made those T-shirts to celebrate the progress that has been made in our borough. And I think our council leader bought one of those T-shirts and now wears it regularly.
Would you, can you send us a photograph of one of those T-shirts and we'll put it in the newsletter?
Absolutely, we can. Yeah.
Brilliant. That'd be great. Big thank you. Yeah, that'd be cool. So thank you very much, and we'll be in touch.
Thank
Bye-bye.
you.
Bye.
Bye.